Welcome to another episode of Med Madness, where we dive deep into essential medical topics to help you sharpen your knowledge and clinical skills. Today we're focusing on a critical condition that every healthcare professional should be aware of: Serotonin Syndrome. This is a potentially life-threatening disorder caused by an excess of serotonin in the central nervous system. Whether you're a medical student preparing for exams, a resident on the wards, or a practicing physician, understanding serotonin syndrome is crucial for patient safety. Next, let's discuss what serotonin syndrome is. Serotonin syndrome occurs when there's too much serotonin activity in the brain, often due to drug interactions or overdose. The condition is characterized by a triad of symptoms: mental status changes, autonomic dysregulation, and neuromuscular hyperactivity. Let's break down these components. Mental status changes. Patients often present with anxiety, agitation, or delirium. In severe cases, this can progress to confusion or even coma. Autonomic dysregulation. This includes symptoms such as hypothermia, hypertension, tachycardia, diaphoresis, and gastrointestinal disturbances like vomiting and diarrhea. These symptoms are due to the overactivation of the autonomic nervous system. Neuromuscular hyperactivity. This manifests as tremor, clonus, hyperreflexia, and in severe cases, generalized muscle rigidity. Next, let's explore the causes and risk factors. The most common cause of serotonin syndrome is the use of multiple serotonergic medications. For instance, combining an SSRI or selective serotonin reuptake inhibitor with an MAOI or monoamine oxidase inhibitor can lead to dangerously high serotonin levels. Even over-the-counter medications like dextromethorphan, found in many cough suppressants, can contribute to this syndrome when combined with other serotonergic agents. The key to diagnosing serotonin syndrome lies in recognizing the characteristic triad. However, it's essential to differentiate it from other conditions with overlapping features such as neuroleptic malignant syndrome, malignant hypothermia, and anticholinergic toxicity. For instance, neuroleptic malignant syndrome, which can occur with antipsychotic use, also presents with hypothermia and altered mental status, but it typically involves severe muscle rigidity rather than the hyperreflexia and clonus seen in serotonin syndrome. Now let's discuss the management of serotonin syndrome. Management involves the immediate discontinuation of all serotonergic agents. Supportive care is essential, including intravenous fluids for hydration, cooling measures to address hypothermia, and short-acting antihypertensives like esmolol for blood pressure control. Sedation with benzodiazepines, such as lorazepam, is used to reduce agitation and muscle contractions. If the patient does not respond to initial supportive measures, cyproheptadine, a serotonin antagonist, is administered to lower central serotonergic activity. In severe cases where the patient's temperature exceeds 41.1 degrees Celsius or 106 degrees Fahrenheit, immediate sedation, paralysis, and tracheal intubation may be necessary. Let's consider a real-life scenario to bring these concepts to life. A 28-year-old woman with treatment-resistant depression has been taking phenelzine, an MAOI. She recently stopped taking her SSRI escitalopram, but only waited 1 week before starting the MAOI. She presents to the emergency department with agitation, diaphoresis, hypothermia, hypertension, tachycardia, dilated pupils, and severe tremors. Given her history and symptoms, serotonin syndrome is the most likely diagnosis. Her management included the immediate discontinuation of phenelzine, administration of intravenous fluids, and sedation with lorazepam. Cyproheptadine was also given, leading to a gradual resolution of her symptoms. This case highlights the importance of recognizing the signs of serotonin syndrome and the need for caution when switching between serotonergic medications. To wrap up, serotonin syndrome is a serious but preventable condition that results from excessive serotonin activity in the brain. Key signs include mental status changes, autonomic dysregulation, and neuromuscular hyperactivity. Early recognition and appropriate management are essential to prevent complications. Thank you for tuning in to this episode of Med Madness. Be sure to check out the pre- and post-podcast quizzes to test your understanding, and don't forget to review our Anki flashcards to reinforce what you've learned today. Stay curious, stay informed, and we'll see you in the next episode.